Hello, my name is Lorhasbi. I'm one of the OBGYNs at the Niagara Falls Memorial OBGYN Center. I am originally from Central Washington. I grew up in a small town called Yakima, very similar, honestly, to Niagara Falls and the area around it. I went to medical school at the Pacific Northwest University of the Health Sciences, also in Central Washington. Did my residency in OBGYN at St. John's Episcopal in Far Rockaway, Queens. And then moved here afterwards because my wife and her family are also from this area and we were looking to settle down. I originally went into OBGYN because I strongly believe that every person deserves access to good quality health care. And particularly with the OBGYN Center, we're able to offer preventative care and very up-to-date, current treatment options for people who have GYN issues. I'm speaking not just for myself, but every provider and staff worker who works at the OBGYN Center. We've all seen the benefits that can come from regular preventative GYN care and the medical and surgical treatments that we're able to offer for people's particular issues. One of the most frequent complaints that bring women to our office are heavy, painful, or irregular periods. Sometimes we talk about the menstrual, or your period as the sixth vital sign, because a change in it can be a sign of an underlying issue, or just there's a problem that requires intervention. Oftentimes, the treatment for painful periods can be changing your diet or trying over-the-counter pain medications, but many women still require hormonal treatments in order to be able to live their lives comfortably and safely. For people who hormonal medications are either not safe to take or poorly tolerated, we oftentimes will offer surgical treatment as well. Fortunately, at Niagara Falls Memorial, we are able to offer minimally invasive robotic GYN surgery for our patients who need it. This means that patients who require surgery can often recover with less pain and have a quicker recovery than people who undergo more conventional surgery. Also, we are able to safely address people who've had previous pelvic surgeries and or have lots of scar tissue in the safest, most appropriate way possible. When it comes to preventative care, a few simple steps early on in the development of disease can often make a big difference, especially when it comes to the kind of consequences and complications that can happen when something has been going on for a long time. In particular, for us as gynecologists, we offer screening for cervical cancer through pap smears. Oftentimes, pap smears only need to be done every couple of years, sometimes even 5 years apart at most, when results are normal. However, the purpose of the pap smear is to detect cervical cancer before it has time to develop into overt cancer. Generally speaking, it takes about 5 to 8 years for cervical cancer to develop. And so for someone who comes to our practice and receives pap smears regularly, oftentimes not even annually, we're able to detect cervical cancer before it becomes a major problem. When detected in its early stages, cervical cancer can be treated with a same-day procedure that people tolerate very well. Speaking for myself and everyone at the OBGYN Center, we know that it can be uncomfortable coming to see your gynecologist. That said, your comfort is our utmost priority as we go about addressing whatever issue that you have that brings you to us. Although it may seem strange to come see a doctor when you're not feeling ill, there are a lot of things that we can do to help people at every stage of their life. For younger people, the conversations that we have typically revolves around, where you are in your personal journey of having a family. We also offer a variety of screening tests for different types of infectious diseases or STDs, depending on the situation. There are immunizations that can be given that will help reduce your risk of cervical cancer. So we talk about those as well. And then, just in general, we check in and make sure that everything is going okay. Not just with your period, but with your other medical issues that you may be experiencing. So as people move into their 50s, often they will begin to experience menopausal or perimenopausal symptoms. Menopause is just a term for when someone has not had a period for more than a year, but some of the symptoms that surround menopause can happen many years before that. Many people will experience hot flashes or itching or burning, in that particular part of their body, or have pain during intercourse. Again, fortunately, there are a lot of things that we can do to help with that. And so we just encourage people to come in and talk to us when they feel comfortable. Seeing your GYN shouldn't end at menopause, particularly because as you get older, it can become more common for cancers to develop. And so even after menopause, we'll continue to see people to make sure that their bones are strong and that they're getting the vitamins that they need and minerals that they need to keep them strong, but then also screening for breast cancer, cervical cancer, and sometimes ovarian cancer continues. So we encourage people to continue to see us. The most important thing for me when someone comes in for an annual visit is to make sure that if they're having an issue or a problem and there's something that I can do that will make it better, that we're able to provide that service to you. We can discuss good habits for healthy bones, what's necessary for a healthy lifestyle, and also what kind of treatment options are available when you have very common infections of the bladder or down below. We also discuss your menstrual as the sixth vital sign and make sure that you're having a regular, normal flow. And if there is an issue, there are a lot of things that we can do to help. People also sometimes have questions about pregnancy and the time immediately before and after it. All of our providers are very experienced with family planning, whether it's discussing what birth control type is best for you or the best way to go about trying to become pregnant and just preconception counseling in general.